Welcome, welcome, welcome. Thank you all for joining us. I'm so happy that you've decided to share this space with us this afternoon or evening, depending on where you're joining us from. So I want to just take a moment to let you know who you'll be spending the next hour with. I am Laprecia Berry Daniels. I'm the Executive Director of Planet Detroit. And we're being joined as well by Dr. Aisha Harris, a family physician at Harris Family Health and a health equity fellow at Medical Society Consortium on Climate and Health, as well as Dr. Andrew Lewandowski, a climate medicine physician, a general pediatrician with Group Health Cooperative of South Central Wisconsin. And then finally, Ambirr Momon, a parent and community reporter at Planet Detroit. So again, thank you, welcome, and thank you for spending this time with us talking about a very important topic, climate and children's health. Just want to take a moment to thank WMed for providing continuing education credits. So for anyone who would like to claim those, you can text the activity code shown on the screen to the number that is also found on the screen. You do need to do that within 24 hours of the webinar's end in order to sign in, complete the assessment to get those credits. And we'll also show these instructions again at the end, and the activity code and the number to text are in the chat as well. So we will circle back to that to make sure everyone has that information. So just to get started and ground us, do some level setting, we'll be talking about climate change, how it affects our health, and especially how it uniquely affects the health of children. Just to clarify who we're talking about when we say children, we are talking about little bitty babies all the way up to 17-year-olds. So the full gamut of what would be considered children. A recent report from the EPA shows some key challenges that children specifically face from climate change, and really highlights 5 areas of importance. And we'll be focusing on those areas as we go through our questions and our discussion with our panelists today. So those 5 areas are extreme heat, flooding, seasonal allergies, air quality, and infectious diseases. The report found that experiencing extreme heat can negatively impact learning in children. It also noted that a warming climate could expose children to more particulate matter and ozone levels, or in layperson's terms, poor air qualities or bad air quality, which can trigger respiratory or breathing issues. The report also highlighted how flooding can pose safety risk and psychological stress to children from being displaced from their homes. And it can also cause health issues from bringing waterborne pathogens and mold into spaces where children live, learn, and play. The report also talks some about infectious disease and how those could become more prominent as temperature and precipitation changes affect the range and density of pathogens, vectors, and hosts that carry diseases like Lyme disease, for example. And then also as seasons lengthen and temperatures warm due to climate change, there's an increase in exposure to pollen, which can lead to higher rates of seasonal allergies and asthma exacerbation. So again, the purpose of today's webinar is really to help improve the communication between medical providers and families about this topic. As we spoke with panelists about this, it seems like climate change and health really just comes up when there's a problem, like an asthma flare-up. And we want to help make sure that these conversations are more proactive instead of reactive. So again, thanks for joining us today to learn not just about how children are affected, but how we can better address the impact of climate change on children through having some intentional conversations. So let's go ahead and get started. I want to start engaging the panelists in this conversation. So Ambirr, you have 3 children. They're 7, 8, and 10 years old. Those are really fun ages. Tell us a little about how aware you feel about the impact of the environment and climate change on your children's health. Oh, Ambirr, you're on mute. We're missing all those jewels you're dropping.
My apologies. Okay, thanks so much for the introduction. I definitely appreciate it. And I feel like I am a proactive parent, so I feel somewhat knowledgeable about the health risks associated. However, I do feel like I don't have as much access to the knowledge as I would like. I learned that through like taking my children recently to the physician. So now that I do know better, I'm able to ask those questions to get a better understanding and kind of be more proactive with their health, especially with me living in Detroit in the urban area. I'm in District 2, so for me, we have had a lot of issues with flooding over the last couple of years post pandemic. So just knowing better and knowing what questions to ask my children's healthcare physician, I feel like that has helped me a lot.
Thank you for that. So it's good to hear that you're proactive in actually having some of these conversations. What are you bringing up in these conversations?
Some of the questions I do ask include what with the health with the regular health checkups that I take my children on, or maybe the short and long term impacts of our poor air quality. My children do a lot of outside outdoor activities. I have two sons, so football season, they're running rampant, swimming. We're doing outdoor activities. So I'm just asking more questions about the air quality, what I can do to assist as a parent, or like maybe the symptoms that come from maybe poor air quality. They haven't been really having asthma symptoms, but I know that it's hereditary from their father's side, so they are a carrier for asthma. I've also been asking about the exposure to flood water and how it's affecting their overall health. How I can minimize exposure on poor air quality days. So if there are certain times that they need to be inside, or certain times I should allow them to go play outside after a certain time. I'm asking those kind of questions. And also, I'm asking like what I can do as a parent to reduce their exposure to poor air quality during like outside gatherings, community gatherings, and some of the frequent places that we do go, like the park and the swimming pools and the football fields during these summer seasons.
Perfect, perfect. Thanks for that, Ambirr. You're really on top of it. So you're definitely asking. It sounds like to me you're asking all the right questions. Um, but Dr. Harris, you have a family practice based in Flint. Tell us why it's important that we're talking about this subject in the healthcare setting.
Yes, no, thank you for having me. I really love that we're having this conversation because everything impacts health, and climate change is its own social determinant of health,
Mhm.
meaning that it directly and indirectly impacts my patients, the community, other Michigan residents, and around the country. But as doctors and other health professionals, we're one of the most trusted people in the community. And so people come to us when they are concerned about things, when they need help regarding their own personal health, their family's health. And so we're in the right position to help educate people and help them with the impact of climate change is having on their health. I know that there are acute and kind of chronic problems that present themselves because of climate change. And a lot of people might feel the things that happen in that immediate sense, but might not know the long-term impact that Ambirr was kind of mentioning that could happen to themselves or their family. And so having the discussion with our patients and in our communities is really important. So that way they know it's not just a passive thing, but it's something that we should be aware of and try to decrease the impact of and decrease the presence of, because it's going to impact our quality of life and how we function in our communities.
Thank you for that. Dr. Harris, you really talked about why it's important to be having these conversations. And Dr. Lewandowski, I'm wondering if you can add something here about how the medical community is going about integrating these conversations into children's health visits.
Yeah, I would, again, thanks for having me too. I would say that the medical community isn't really integrating these discussions
Mhm.
very well currently. I mean, when was the last time anyone took their kid to a checkup, or you went to your own checkup and someone was like, let's talk about climate change and health, or let's talk about the environment and health? I mean, I would argue that we're not really too far in. That being said, I mean, there are definitely folks at a lot of different institutions around the country who are doing really good work with CME, and people, groups like yourselves who are making CME events like this to try to spread the word. But I would say right now, if I had to grade how healthcare was doing with integrating climate change or the environment into health, much to the chagrin of, I'm sure, Dr. Harris and I, we're not where we want to be. But that doesn't mean we can't. And there are so many different ways that you can integrate climate change or the environment into health, that really any specialty, any subspecialty can do it. And it's just a matter of figuring out how it's important to you and how you think it's going to affect your patients, and making it happen just like any other healthcare topic.
Yeah, I appreciate that. And a little later, we're going to actually get to some of those actual solutions that you're sort of baiting us a little bit, telling us that there are some ways to better integrate that. And so we will be talking about that a little later. I wonder if we can dig a little deeper specifically about how climate change impacts children. Dr. Harris, what are some of the specific health concerns around this that you're seeing at your practice in Flint? Oh, you're muted, Dr. Harris.
I had a really good statement, I'll say. I'll start off by saying that Flint is an environmental justice community. And so that means that we have been disproportionately and significantly impacted by different environmental concerns and environmental decisions that have been made for our community and our neighborhoods. And so with that, it's not a secret that we had the Flint water crisis. That's more of a man-made issue, but a lot of things that happen in Flint right now is related to air pollution. That's probably our biggest thing. Being the vehicle city, being an automotive, industrialized kind of city, we have a lot of lingering and just building impact of the factories on our air quality. And so that impacts our children when at base there's just air quality issues, but then if there's a flare up in a factory or the tides change with how the wind's blowing or something, there might be a little bit more asthma attacks or respiratory issues in general. But we also have globally and not just uniquely in Flint, the extreme heat problems. Those impact children significantly because they are a little bit more prone to dehydration because of just their size and ability to remember that they should be hydrating. And so with extreme heat, we have a lot more consequences of the dehydration, of hospitalizations, of chronic issues possibly flaring up during those times, because those heat waves are happening a lot more frequently and a lot more intensely. It's not just something that's happening in Florida, but Michigan residents are feeling that impact too. And I'll additionally say, not necessarily unique to the Flint area, but I've had to have a lot of conversations about the impact of extreme weather events on my patients. Flaring up their asthma and flaring up their allergies, making it just difficult for them to navigate in those short periods of whatever the thunderstorm or the tornadoes. They're just happening a lot more frequently, a lot more stronger. And so those are conversations I had to have beforehand, but also afterwards of why, they aren't feeling so well right now because of the weather shifts.
Thank you for that. Dr. Lewandowski, can you share a bit about what it looks like in Wisconsin, where you're practicing? What are you seeing in terms of climate change and how that's impacting children in particular?
Yeah, I mean, I think you could probably spend a lot of time talking about a whole bunch of different areas. I think maybe some things that I'll talk about that are cross-cutting would be, so first is like medication safety. For example, if you have a kiddo who's a type 1 diabetic, their insulin shouldn't really be stored above 87 degrees. And so if it's being, kept out on the counter, or if it's, stored somewhere in a cabinet or a closet, and your family isn't running the air conditioning and it gets really hot in your apartment or your house or wherever you're living, you all of a sudden have insulin that's not as effective as it should be or not doing its job. And we know that there are pretty significant ramifications for kids who need insulin to live, not having the medication working the way it's supposed to, or other drug levels. If you have a child who needs to have drug levels for seizure medication that's monitored. There are a lot of day-to-day things like that. And I think the other thing that people really miss out on is, especially for kids, that day-to-day life and that routine is so important. And if you're a parent, a lot of times we feel that, what it's like when your kid doesn't get quality sleep. But we also know that heat does not help us when it comes to getting quality sleep. Or, I think people are always like, oh, well, is something going, what's the mortality rate? Meaning, what's the likelihood that something is going to kill somebody? But morbidity is such a big factor with climate change on the day-to-day. So, if I have a kid who has seasonal allergies, and again, we were just talking about sleep as an example, and they don't get good sleep because they couldn't breathe through their nose, despite doing their Flonase or their, antihistamines or whatever it is that they were using. There's so many of these little things day in and day out that just kind of affect the daily life of kids. And without that routine, without that structure, I think that's probably one of the big things that we see. And then it has a toll on us as parents too, and as a family unit. So there are a lot of things. And I would certainly second what Dr. Harris was talking about with air quality. I guess specific to Wisconsin, I don't know. I feel like Michigan and Wisconsin have a lot in common. But, there are a lot of lakes, a lot of rivers, streams. We know that water quality certainly can be an issue. In Wisconsin specifically, we do have one of the higher incidences of Lyme disease. That would be something that y'all probably don't really have unless you're counting the UP. But it sounds like most of y'all are in Detroit. So I'm pretty far away from the UP, but Lyme disease would definitely be a factor. So, yeah, there's a whole host of things, but I don't want to monopolize the whole discussion right now with that question.
No, I appreciate that. And you brought up some things as a parent myself that I hadn't really considered. And so, Ambirr, wondering sort of to close the loop here, hearing what Dr. Harris and Dr. Lewandowski just talked about, what concerns does this raise for you?
I feel like my main concern as a parent, what I can do to, again, reduce my kids' exposure. But of course, with climate change, it's one of those things that, like Dr. Lewandowski was saying, is not really being talked about. So I am one of probably none or very little parents at my children's health practice that is asking those questions, that is pushing the envelope. So I guess I would want to know where we are as far as getting access and knowledge out for the types of questions that more parents should be asking so that we can get the conversations going. Because I feel like a lot of times, because we don't know better in a lot of urban communities like the one I'm from, we don't do better. So once people get to talking or telling people about things, then like that secret, it gets out, and then people get to wondering, people get to researching and asking questions. And in the social media world we live in, unfortunately, if it's not online first, we don't hear about it as millennial parents. So I just would love to see what we can do as a community to kind of get these questions going, because being one of none is hard in any parent atmosphere. So me being the one parent that's always pushing the envelope or pushing the glove is kind of counterproductive, because if I'm just one and you see 100 patients a day and none of the other parents are asking these questions, nobody really cares. It's swept under the rug often. So I guess my question would be is how we can get more access to the issues regarding climate change and the issues that we are facing and seeing as parents and healthcare professionals, kind of seeing how we can get more access to people that look like all of us that are being affected, because we don't really, I guess, realize, and because these issues aren't brought to the forefront or becoming conversation starters often, how we can, change that or kind of get that going.
Thank you for that, Ambirr. And so we'll accept that charge. We'll start talking about solutions right now. How about that? So I want to start with Dr. Lewandowski. You've studied the effects of counseling families on climate change impacts. Really want to talk about how families and providers can better work together to address these health concerns, similar to what Ambirr was just sort of pushing us to do, so that she's not one of none, so that a lot of other clinicians are approaching this conversation, and also parents feel more comfortable approaching this. But just talking about the effects of counseling families on climate change impacts, tell us how that worked. What sort of outcomes did you see?
Yeah, sure. And I think one of the things I want to do before I answer that question is just kind of back up where this journal article came from, which is that I looked at the American Academy of Pediatrics. They have a essentially a best practice in their own So every major medical organization, like the American Academy of Pediatrics or anyone else that's part of your specialty, they usually put out a journal that tells you as a pediatrician what is the most current, most up-to-date stuff that you should be doing. So if there is a new guideline for how to treat ear infections, as a doctor, you're like, oh, I should really be doing that to make sure that I'm up to date and doing the best thing that I should be. And in 2015, the American Academy of Pediatrics had a whole journal article about global climate change in children's health, and they said in one of their recommendations that we should be incorporating the effects of climate change and health into the anticipatory guidance framework, meaning what we should be talking to our families about, what we should be counseling about. And so I found that out in 2019, and I was already sort of into climate medicine, and I was really excited about that. But then I was like, oh my goodness, I'm like 3-4 years behind on a recommendation that I feel like, as somebody who's hoping to be at the forefront of climate medicine and climate change and health, and I honestly felt like a little bit of an imposter. And then I was like, okay, well, what should I do? I mean, I'm really just a community pediatrician, and so you sit down and you think, okay, well, just like I now have to talk about screens in a different way, or just like you talk about discrimination with families, or you talk about other things that maybe aren't your classic, fruits and vegetables, food pyramid kind of stuff that you've heard ever since you were a kid. Like, how do you bring that into your clinic? And so it just took some time, and I thought about how I wanted to do it, because I was like, yeah, I got to do this. But then when you start having discussions with your colleagues, I found out that no one else was really talking about it. And they're like, well, does it work? Like, tell me more about your discussion. And that's where this study came from, was me just surveying my families who I counseled. And I provided anonymous surveys to see what their responses would be. Because just because you're not having anybody walk out of the room, no one's like throwing stuff on the floor because you're, some tree hugging dirt worshiper or whatever else kind of a doctor, some fringe physician, doesn't mean that they don't have opinions. It also doesn't mean that it's influencing or resulting in behavior change. And so that's when I decided I was going to standardize a script that I was going to tell to each family. And then I was going to measure their responses to that. And so what I was saying, let me see, it's been a while since I actually used this exact same script. So I guess I could, it was just like, well, I don't have to say the whole thing, but it was essentially like a 30 to 45 second snippet of time through the course of that visit, where I said that, there were over 100 health organizations that have declared climate change an emergency, a health emergency. And just like it's important for you to be, in the right car seat and eating healthy diet, it's also important that we work on reducing our energy use or supporting clean energy initiatives, things like that. And then making space to talk about climate change and health and its impacts on children. And so I wanted to know, did people already know about climate change and health? And a lot of people, about 82% of people, said they already were aware that climate change affected health. But despite that, about 88% of patients or patient families said that they learned more as a result of my 45 seconds of counseling. And the majority of families, the vast majority of families, and this was cutting across all political lines, said that they were more likely to support clean energy initiatives, more likely to change their energy use or increase energy efficiency as a result of the counseling provided in the office. And so, I think there are a lot of communication and about climate change and health takeaways that I'm more than happy to share. But I think the main thing that I just want to mention is that all I was doing is following recommendations, and I didn't have any negative reactions from my families. It was pretty much embraced as like, oh, okay, well, if this is a health topic and that's what, Dr. L is telling us, then yeah, we should probably do that.
Well, thank you.
And I did offer a free response section, because as a physician, whenever we get back things like Press Gainies or patient satisfaction and stuff, like if someone doesn't like you, they are more than happy to blast you an anonymous free response section. And so I did want to offer that. The worst comment I got out of 96 comments from families was fine, but not necessary. I mean, after that, I was like, oh, okay, we can do this.
Yeah, that's like an A-, right? Fine.
Yeah, I'm like, oh, okay, yeah. B+ maybe.
Well, thank you for sharing that. One of the things that you mentioned was this took 30 to 45 seconds. And it makes me think about what I've always heard. So it's worth mentioning, I'm trained as a medical social worker. And so we always heard sort of that the doctor just doesn't have time, right? And so I imagine there are other barriers, though, that come up for having these types of conversations. Dr. Harris, can you talk a little bit about what barriers you think there might be to clinicians having these types of conversations with families? Because according to Dr. L, I just found out he has a nickname. According to Dr. L, people thought this was a fine thing to do within the framework of a pediatric visit. And so what types of barriers do you think clinicians would come up against in a setting trying to have these types of climate counseling sessions, if any?
Oh no, there's definitely barriers to patient care in general, not unique to the climate change kind of conversation. One of the things that he mentioned was, it was a 40 second script for the study, which can be implemented outside of just the study overall. But the reason that is probably that short is because of the time restrictions and time constraints of an appointment. So I won't really elaborate on that because everyone has had their experiences in the appointments and realize that there's a lot being said in those moments. But I do want to kind of highlight outside of the time aspect, what Dr. L was talking about earlier was that he kind of came into the conversation already behind, and he had an interest. And so there's a lot of doctors and other health professionals out there that are curious, but not kind of educated on climate change impact and what they should be saying or what they can say. They just know just as much as their neighbors and their friends. And so there are a lot of people who may not be comfortable with speaking more about the impact of climate on health or climate in general. And so when you don't quite know enough about something, you might not bring it up because people might ask follow-up questions that you don't have the answers to. Which I know we'll talk about a little bit later with kind of resources. But the other challenge is integrating it into the conversation of the appointment. And so people come to appointments for different reasons, come to the ED for different reasons. And so sometimes that acute problem or that chronic problem follow-up, it may not be a natural transition to talk about climate change and climate health. And so if that's not on someone's radar to speak about it, it may not be on the forefront to actually bring it up no matter what. We have a lot of screening questions that we ask in pediatrics and adult care that are prompting us on our computers or just part of the way we kind of just do things, our protocol and our style of practice. Climate questions and climate change conversations and counseling are not on those lists. And so that would be a long-term kind of benefit, is just having that prompt to be able to go through those questions, go through those concerns. But outside of time, I definitely think knowledge and the opportunity to apply it in a conversation more naturally are probably one of the biggest barriers that health professionals have.
Yeah, thank you for sharing that. There are two things that came to mind. The first is Dr. L, you were saying sort of how you came up with this idea, just there's a problem, I'll figure out a solution. And Dr. Harris, you're saying that there's this knowledge gap or a gap in terms of how to communicate, have these types of conversations in sort of a graceful, efficient, and effective way. What, besides Dr. L, coming up with this 30 to 45 second script and doing this in his practice, what other groups are there that are supporting this type of work? What other organizations or groups are doing that? And this is to either of you, Dr. Harris or Dr.
L. I can start. So I'm involved in MiCCA and some other environmental justice related groups. And so a lot of the work that they are doing is more in the community. But one of the things that they are trying to do is get more doctors, physicians, health professionals involved in the climate conversation to fill that gap. We learn a lot of things in medicine. We call the idea of being a doctor kind of a continuing education journey. And so the things I learned about diabetes, the things I learned about asthma when I was in medical school, things have upgraded and changed. And I've learned more skills and more knowledge about other medical problems that have come up. And so climate change and climate health is no different, that we need information to be out there so that way doctors can be more educated and more informed. And so the organizations that I'm part of helped me learn more because a year ago, I was not this deep into the climate and health conversation, but I was curious enough to learn more, join some groups to have an organized way to learn more. And it's put me in a better position for my patients and my community to educate people a lot more effectively and thoroughly. But I think filling that knowledge gap and putting people in the position to be informed in order to educate their patients is probably the biggest step that most organizations are taking when it comes to like direct patient care outside of the advocacy side of things.
Yeah, I would really second that. I mean, you really have to start with figuring out what that overlap is between climate justice or environmental justice and health. And then once you have that, I think the biggest thing that's hard for most of the providers that I know, even those in that climate justice space, is fear and kind of getting over that to start practicing. Because one of the things that we don't have is we don't have best practices yet. There's no script, there's no validated one thing or another. It's about, well, how do I take this information, make sure that I'm communicating the relevant information to my families in a way that is tailored to their individual health needs? Because I'm not going to counsel the same way to every single person. I had a standard script because I had to write a paper about it. Like, you can't use different scripts and then publish the same survey results. Like, it doesn't work that way. And much like as people, sometimes we're really nervous after we've learned a lot about like different foreign languages. You're like, but then you're learning Spanish and then you go to Spain or Mexico and then you're like, oh, I can't use the language. I don't want to say it because I might mess up. I might not say something right. But like, unless you practice until you really dive in and start doing it and get over that fear, it's hard to grow and hard to learn. And I think doctors put a lot of pressure on themselves. Healthcare providers in general put a lot of pressure on themselves to make sure that they have all of the right knowledge and they don't want to say anything that's wrong or inaccurate. And, it's really easy to have answers for a lot of the same day-to-day stuff that you already know. But if it's something new, sometimes it does take a little bit of courage to say, hey, you know what, that's a really great question. I don't have an answer to that. Let me look that up and I'll get back to you. So there is a lot of there are a lot of barriers, but MiCCA, so the Medical Consortium for Climate and Health, they have a whole bunch of state affiliates, which MiCCA is one of them. We have Healthy Climate Wisconsin is the Wisconsin state affiliate. There are state affiliates from a lot of different states. There are national organizations, there are international organizations that can help. But then the other thing that a lot of providers don't know is that major medical groups like the American Medical Association, the American College of Physicians for internists, the American Academy of Family Practitioners for family practice doctors, the American Academy of Pediatrics. There are so many organizations and groups who already have position statements, already have information. All you have to do is start with your parent organizations, really, whichever one makes you feel comfortable, and just start there and move from that space. When I'm sure that when physicians like Dr. Harris or myself come to these sorts of events, don't be shy about following up, or at least asking to follow up. I bet neither one of us bite, and we're probably more than happy to answer questions. And I would bet that this is also not her first event. Like, we'll talk at other spaces. We're happy to spread that message, and it's about planting seeds so that other stuff can grow. And I do like to compare climate and health to smoking, not because the air quality thing, but because once upon a time, physicians were like, you should use filtered cigarettes because they're safer. And now, like, you can go to any healthcare clinic and say, hey, is smoking bad for your health? And it's a no-brainer. So how can we get to the point where you can go to any healthcare clinic and say, is climate change bad for your health? And it's a no-brainer. You know, that like when we talked about smoking, that was something that was commonplace. It was something that was normalized. It was something that was accepted as okay. And then our job as a medical community was to change the perception around this normalized harmful thing. And now with climate change, now that we learn more and more about that, our job as providers, in my mind, is to flip that script and make sure people understand, yeah, you know what? Is it a thing? Yes. Do people not know everything? Yeah, there's a lot of stuff that we have to correct as far as public perception, but climate change and health is dangerous. It amplifies so many existing climate change harms and health disparities and health inequities and so many different things. And it's about really flipping that perception and flipping that script.
Thank you both for that. Ambirr, did you want to add something? I just saw you nodding. Maybe it was just agreement, but if you wanted to add something, feel free to do so.
No, I definitely agree. I believe that I'm super big on community. So, what both of you guys spoke on and touched on about just adding a community. And I feel like a big thing, being a mom, being a parent, a single parent, that is once I know better or once I am made aware of an issue, I call myself a change agent. I can't just sit with it. I can't just let it resonate. I have to be proactive. I feel like me doing that as a single mom, it gives a voice to other single moms and parents, especially, to kind of move the needle on issues like this. Because just like when Dr. Lewandowski said it's equivalent to smoking, I agree with that. Climate change is a big deal, and I feel like if we don't get in front of it soon, we'll be behind it. And I feel like it's going to be a bigger issue if we don't have these conversations now. Get proactive now. Being reactive versus proactive is a whole different beast. So I definitely agree with both Dr. Harris and Dr. Lewandowski with what they said. It definitely resonated as a parent that we just need to get active. We need to, instead of continuing to complain about these issues that we know are right in front of us, go out, figure out how we can help, how each one can reach one, and how we can get it out to the masses so that we can all become, as a community, proactive instead of 5-10 years from now being reactive to like a global phenomenon that is just we can't retract that, or we can't go back and say, hey, well, we knew about it 10 years ago and we just sat here and we talked about it. No, we have to get out and be active about it and just kind of make those strides in the right direction, because I do believe that our kids, we are raising the children of the future. So it's just kind of like one of those things where it's like, what does the future look like for our kids and their kids? And kind of reaching back and figuring out what society we want for the next generation. I think that's important.
I love that. Thank you, Ambirr. There are a couple of things that I think all three of you sort of said, and you talked about sort of there not being a handbook of how to have these conversations. I think there's no handbook for parents on how to approach this when you go to the doctor. I think about a group that I was working with before where we gave expecting moms a booklet to take with them to prenatal visits so they could ask the right questions, right? We don't have a booklet to take with us as parents to ask the right questions about climate change and health. However, our partner for this webinar is MiCCA, so Michigan Clinicians for Climate Action, and they actually are working on a resource to help both providers and families figure out risk factors in their communities and provide prompts on how to discuss those in a healthcare setting. So I'd love to give each of you a brief moment to share what you would like to see in that or what hope it's used for. So Dr. Lewandowski, I'm going to start with you, but just want to hear from each of you about, as they're putting together this resource, what would you like to see in it? How would you like it to be used by parents, by providers?
I mean, I think that the best information starts at the community level. And it's about realizing that there is, and I know that they already know this at MSCCH, but it's about realizing that there is no one thing that's going to fit every community. There's no one size fits all. And that's why, people like Ambirr are so important That's why, individuals in each community are so important, because it really has to be tailored to that community health. I think that general resources about the ways in which climate change affects human health is important. I think that it is imperative that people recognize things like a legacy of racism and other inequities, and how those are exacerbated by these amplifying health issues like climate change. Because to me, climate change is kind of like a magnifying glass. I can't do an X-ray to find climate change in your chest, but we know that climate change is going to amplify those existing health harms. And so, how are they going to disproportionately affect certain communities? And I think that when you're looking at any kind of solutions portion of some kind of manual, or a solutions portion of brochures or other stuff, making sure that we're realistic that those are, equitable climate solutions or equitable adaptation strategies, not just, saying like, oh, we'll just put solar panels on your roof. Oh, great. Well, I rent. Oh, and by the way, if I'm renting, I already probably have one of the lowest carbon footprints. Maybe you can tell me a little bit more about how to adapt to some of the health harms that I'm feeling. And so I think it's hard to answer that question, just because there's no way to kind of put every community in one handbook. But you have to start somewhere, so that it sort of plants those seeds, so that people take some of that information and then generalize it to their local communities, so that local health departments, county health departments, community physicians, like Dr. Harris or myself, or reporters or other people, can really bring that into their practice in the way that they see it. And then I am seeing a comment about someone saying something about the ICU, which is that they're also different specialties. How I'm going to talk about climate change in my well child checks are going to be different than how you might incorporate a conversation about climate change into an ICU, or as an anesthesiologist, or a surgeon, or a pathologist, or an endocrinologist. And so maybe offering that there are ways of doing that in every medical setting, and sort of pushing that forward. Those would be the initial reactions that come to mind to that question.
Thank you for that. I love the idea of, it's great to have a starting place. So having this resource is a great place to start, but also recognizing that the resource would have to be flexible. Anything to add, Dr. Harris?
He said many of the things that I was going to mention, but I want to emphasize kind of the importance of it being a starting place, that whatever resource handout, quick kind of fact sheet is just going to give someone the glimpse, and it should be able to spark curiosity for them to learn more. It would be great kind of connecting with the flexibility that he's talking about, if there's connections to something local, because I personally mainly care about Flint. I care about everything else a little bit less as I get farther and farther out of where I'm at. And that's because where I'm at is impacting me personally. And I think patients and residents feel that same way. They don't understand something that's happening globally, because it's like, that doesn't feel like that's touching me. Something happening nationally, oh, that's a little bit closer. Something happening in Michigan, okay, now I understand a little bit better. But something happening in your county, on your street, in your city, is a lot more impactful, as far as like, oh, this isn't just something that's kind of, I guess I'll give the example, extreme heat. When growing up, I'm like, okay, Florida's hot, Texas hot, like those are just hot places. But as I got into adulthood, and now, like, Michigan is hot too. And we weren't really ready for the type of heat that we've been experiencing because of climate change. And so it's those type of conversations of things that people are recognizing have happened over the last 5-10 years. And instead of being late to the conversation, kind of emphasizing what Ambirr said earlier, we want to be proactive now. So that way, 10 years from now, we're not wishing that we could, turn the tables when something's not reversible. The other thing that I'll kind of mention with the resources, it has to be understandable on all levels, not just kind of literacy, but also just like knowledge base. And there's a lot of parents, families, physicians who are going to be starting at the same level. And so that resource has to be very adaptable to who's reading it and who's trying to apply it. So that way they don't just ignore it because it's too dense, too complex, or just not something that's interesting to them. But I think tools and resources are very important, and it gives people a starting place. to potentially spark curiosity and hopefully spark their desire to advocate for something to be done. We're talking about things happening in the hospitals and in the clinic setting, but we really want these conversations to go beyond just me talking to my patient or a patient talking to their doctor, but someone having discussions about policy and regulation changes. If we get enough people to care about climate change, that's when we get our legislators to make policy changes and kind of shift and be better prepared and preventative when it comes to climate change. As much as I want to help my patients directly with their health, I also want the community to be healthier, 5, 10, 15 years from now. So the more people that are aware, the more people that are motivated to address climate change, the better. And I would love for resources to kind of help spark that fire, not necessarily, completely turn people over, but at least kind of add to the desire to be proactive and actually make some change.
Thanks for that. And I loved one of the things that you were saying, and I think it would be great if it were in the guide, and then I'm going to give Ambirr sort of the closing words on this one, but having ways that providers can be involved that are beyond in the exam room, right? So you mentioned, Dr. Harris, that you all are trusted experts. And so how do you bring that expertise to public comment? How do you bring that expertise to letter writing or calling, political leaders and like that? And so how do you do that beyond the exam room is really important as well. And I would hope, Lisa, I saw you on there. I would hope that that'll be part of the guide as well that's coming out of MiCCA. But Ambirr, how could you see this type of guide or resource being useful for parents? And you mentioned community several times, so useful for community.
Yes, just to piggyback what Dr. Harris was saying, making things easily digestible for parents. While I know that I have a college degree, a lot of single parents and parents in urban areas do not. So just making sure that whatever we're putting out to the masses is super easily digestible for all parents, no matter what their educational background is or what their psychological mindset, things of that nature are. So just kind of meeting the community where they are. Because while I'm a super involved parent, I thank goodness for the flexibility to be that super engaged parent. I do remember working a 9 to 5 where I just didn't have time. During physicals, I'm in and out. I'm just trying to get the bare bones, the base minimum at a clinician, at a physician appointment. So just making things super easily digestible. I could spend 30 to 45 seconds during the sports physical once a year talking to Dr. L about climate change and things like that. Do I want to spend 10 to 15 minutes when I probably have 3 to 4 things to do after this or before this or that I'm thinking about? Probably not. So just knowing our audience, I think that that's super important. And I think that Dr. L and Dr. Harris did a really great job of knowing their audience and knowing who their patients are and knowing what they can digest. So I think that that's important moving forward when we're looking for tools and resources to assist with having these conversations during well visits or sick visits. Because I know a lot of my colleagues and friends, the only time they're taking their children to see a clinician is if there's a tummy ache or if there's something wrong or if the kid or student is being sent home, then there's a problem. So those well visits are scarce when you have a single parent working a 9 to 5. So I do believe that these need to be regular conversations and just adding those to maybe even those sick visits like, hey, well, did you experience these things or flooding or these type of things? Just getting that background information. I think that's very important. Just opening the door to have these conversations, even when you see that kid, because I know Dr. Lewandowski and Dr. Harris can probably speak more about how irregular they see some patients. So I think that just knowing your audience and knowing who you're talking to, engaging their interest. So if you're seeing somebody once a year, it's kind of hard to say, hey, well, how do you feel about climate change, and asking those probing questions to get those answers. But if you know you're going to see that person one time, that 30, 45 seconds, you may be able to squeeze that in. So I think that that's very important to know who your patients are and be well versed with who you're talking to, the who, what's, when, where's, and why's. Because a lot of times in society and different, especially in the medical field, I feel as a single parent, a lot of times health professionals are talking at us and not to us. So I feel like it's not really a relationship between me and my children's doctors. It's just, hey, let's get you in, let's get you out. And I'm like, no, wait a minute. let me ask these questions about this, this, and this. And they're like, wait, we're not used to this. This is a shock for us, but I'm willing to answer them. But a lot of times there's just not enough time. So just making things easily digestible. So where I'm asking 10 questions, that 30 to 45 minute survey Dr. L was talking about, I think that's super beneficial, even for my kids' pediatrician, because they can ask us, and that will limit my questions if they ask those questions. So just providing people with that access again and that knowledge, I think is super, super relevant and prevalent to this conversation about climate change. So just, getting a conversation started in 30 to 45 seconds, I think would do wonders, because it's a conversation that needs to be had. And if we ease it into 30 to 45 seconds, it doesn't take anything away from the parent. It doesn't take anything away from the physician. It really just adds to us overall as a community, reducing that carbon footprint and, combating the climate change effects that we are seeing that are affecting our health.
Thank you so much, Ambirr. So I kept seeing Lisa pop in. So she is taking notes on what folks would like to see in this resource. And it sounds like plain language is important, it being flexible, and it being two-sided, recognizing that this conversation is co-led, right? It's not led by the physician only. It's not led by the parent only, but it's co-led, and there's co-ownership, because both the physician or provider and the parent are caring about this child's health and well-being and thinking about how climate could negatively impact that, and making sure those conversations are happening. We have a lot of activity, people popping in with comments, and we also have some questions already that have been sent in. And so do want to go to some of those questions.
Before you go to those questions, Aisha, can I tack on two more things just about a resource like that? So another one is that, leading by example is really important. And so I'm not fully familiar with the scope of the resource that you're talking about, but it's incredibly important for healthcare as an entity itself to be working on putting its money where its mouth is, and working on really bringing down their own carbon emissions, working on acknowledging how they perpetuate environmental justice issues or climate justice issues, and how they can be a change agent in addressing climate change adaptation and mitigation strategies in a way that's equitable for everybody. And so any resources about that would be incredibly important, given that the healthcare sector puts out so many carbon emissions and so much waste. And then the other thing too is just that sense of urgency. And it's not urgent because we need to prevent this from happening. It's urgent because it's here and it's only getting worse. And I think about climate change kind of like a cast iron skillet that's on a stove, where you heat that skillet up. And right now with climate change, with more fossil fuels getting pumped into the atmosphere after combustion, what you're essentially doing is like keeping the burner on. But after you stop that, when you achieve that carbon neutrality or carbon negativity, it's still going to be a really hot pan. And so this is just another example of one of those situations where this isn't a sprint. It's not a marathon. It's like a marathon relay. And unfortunately, and I'm not trying to say we shouldn't be working on this. I don't want to discourage anybody, but we're not going to see the flag raised, hooray, everything is done in our lifetimes. Like, this is something that's going to continue being an issue before that cast iron skillet really cools off. And that's why it's so urgent.
Yeah, thank you for that perspective. I appreciate that. And I realize too that I'm over here shouting out Lisa and not saying who she is, as if everyone knows Lisa. Lisa DeBuono is the president and founder of MiCCA. And so that's who I was referencing when I said I see Lisa popping into the chat. But do want to, as I promised, get to some of the questions that have come in advance. And then there is a message there that feel free to post additional questions in the comments, and we are watching for those, and we'll get to as many as possible. One thing that I actually think Ambirr may have touched on a little bit, because she said when thinking about developing this resource to keep in mind plain language and meeting people where they are and their psychological state. And so there's a question that came in about what folks have been calling climate anxiety. So what is the best way to handle climate anxiety of parents and their children when discussing the health implications of climate change?
Is that for anybody?
Oh,
You can take it if you want, Aisha. Otherwise, I'm happy to take it too.
I'll keep this short. I think there's a lot of anxiety around many things. And so climate is just one piece. People worry about housing, people worry about education. And so when I talk about any of those things that may be triggering for someone or increasing their worry, I try to make it a smaller concern in the sense that, like, don't think about the things that are happening globally. Think about kind of just immediately in your community and what is happening in your household. So that way it can be more tangible and a lot more digestible. It is an overwhelming topic. There's a lot of information out there. There's a lot of information that's always changing and we're still constantly learning. So the things someone said on Monday might be different than what is actually the reality on Tuesday. But I think that the climate anxiety is a real concern, especially because of the irreversibility of a lot of the things. And so I just really try and get people to do what they can in their community, in their household, that makes them feel better. And hopefully also kind of contribute as far as civic engagement in the process of addressing climate change. Because when people put their energy towards something, their anxiety can be mitigated because they feel like they're not just sitting back and letting it happen to them. They're actually trying to make some change.
So I am going to move us to another question that is actually on the opposite side of the spectrum. So we have people that have climate anxiety, and then the other question is sort of about climate change deniers. So how do you interact with patients who might not believe in climate change, or address a patient who sort of denies the scientific literature around climate change and health?
Yeah, I can take that. So I think that one of the best things about being a doctor or any healthcare provider, you don't have to be a physician, is that you're hopefully going for the same thing. Everybody wants to make sure that the patient in front of you or their kids or family members, community members, neighbors, whoever is healthy. And so you have that one thing in common. So it doesn't matter, political affiliation, or if you're a flat earther or a climate denier or whatever else, because you do have that common thread. And my job as a healthcare provider is to do the best that I can to let families know what I feel are the best practices to correct or achieve and then maintain health, so that people can, do what they want to do with their lives. And so if I have somebody who tells me that they're a climate denier, or, in so many words, or is, saying that I'm off my rocker, ultimately my job isn't to butt heads with them. And that's, I think, something that we all want to do sometimes, be like, oh, well, you're wrong because of X, Y, and Z, and here's all this stuff, and then here's this person who said this and this person who said that. It's about realizing that there's emotion behind what they're thinking and feeling. If they're passionate about something, throwing a bunch of information isn't going to change what they're thinking. But instead saying, hey, I can see that this is something that's really, really making you, feel, maybe you're feeling really passionate about how climate change, isn't real, or whatever the stance is that they share with you, kind of speak that back so that you validate what they're saying in a way, telling them what they've heard, and then saying, hey, and at the same time, what I have learned, and what I know, and what the medical organizations who work with me are encouraging me to talk to my patients about is X, Y, and Z. And that my job is to do the best that I can to make recommendations on the best available knowledge. And within my scope of my practice, this is the best available knowledge that I have. And if you have questions or concerns, or if there are things you want me to dig deep on, like, that's my job as your health advocate too. So, like, send them my way if you want to, or you feel passionate about that. However, at this time, there are ways that we can reduce our energy use, if there are ways that we can support clean energy initiatives, are there ways in which that you're concerned about, how we can adapt to natural disasters or specific health conditions for your child, that's also my job too. And so that's why I'm bringing it up and just kind of really level with them.
Yeah, I love that balanced approach. So,
Sorry. I was going to quickly add, I want to say that the climate change, denier conversation is no different than someone who isn't ready to get vaccines, someone who isn't ready to take a medication or do a surgery or do some lifestyle shift. And so we do a lot of motivational interviewing in medicine. And so it's not necessarily a whole different conversation just because it's on climate change. People are ready when they're ready, and we just have to keep doing what we can with our resources and our knowledge to know that we're there for them when they are ready to fully kind of commit to something. But it is a continuous kind of persistent conversation that we have on a lot of different levels when it comes to medicine and someone's health.
Thank you for that, for really sharing how providers already have this skill in their tool belt, right? So they already know how to do this. It's just a different topic. So I love that you shared that in a way that should really resonate with providers. We are at the close here of our time together. Thank you all so much. Thanks to each of the panelists. Thank you to all of you that joined us. Thank you to our co-conspirators in this, our partner organizations, MiCCA and Great Lakes Now. If anyone has any thoughts about the resource that MiCCA is putting together to help parents or any patients bring environmental concerns to the clinic, please feel free to reach out to MiCCA. They will likely host a Zoom meeting for anyone to offer feedback, and you can feel free to send an email to them. And I believe the email is there on the slide. Also want to say that Planet Detroit's next webinar will be coming up on September 19th. If you signed up today, you'll receive a notice for that one. If not, go to planetdetroit.org to sign up for our newsletter. And also, I'm sorry, I have to say this because I'm the executive director, and I want to make sure that folks know that MiCCA is an impact partner. And if you're interested in being an impact partner, which means that you support the work that Planet Detroit does, like doing these webinars, like having the newsletter and trying to bring more awareness to issues around environmental health, public health, environmental justice, then do think about becoming an impact partner, MiCCA's impact partner. And that's how we were able to have this webinar together today. So do sign up for the newsletter. Also consider being an impact partner. Again, the info about claiming your CME or CE credits is available here. You have 12 hours. I said earlier that you had 24 hours. You have 12 hours after attendance at this event to complete the assessment and to go ahead and get to earn those credits. So make sure that you do that. Thank you. Go Planet Detroit. I do again appreciate all of you spending time with us. Make sure that you stay abreast of our topics that are coming up. Do make sure that you are registered, subscribing to our newsletter so that you don't miss out on these types of conversations and these opportunities. So again, thank you all.